ERP stands for electronic record. Yeah.
Mwenzi mfalme wa amani uliye juu mbinguni, katika jina la Yesu. Mungu wetu, tunakushukuru kwa asubuhi hii. Umetujalia kuona nuru, nawe nuru ni wewe Yesu Kristo. Umetupa uwepo wako, siku tumelala kama kufa, ila Bwana umetuamsha kwa ajili ya kuiona siku nyingine uliyotujalia. Wacha Mungu tuifurahie na kuishangilia. Kuendelea, siwezi kuendelea zaidi, nitamhusisha yule ambaye ndio mkuu wetu hapa, daktari wetu, aje aendelee zaidi hapa. Barikiwe.
So we are so glad to have partnership with the Barani doctors. And I also believe that now that the PCN is starting, I believe it's for the benefit of the Barani community.
Naitwa Daudi Madawa. Mimi ni msimamizi ya afya ya jamii, Ward Public Health Officer, Mtepeni Ward.
Good morning. Good morning. My name is Susan Wamburi. I deal with HIV and testing and also counseling. Karibuni.
Habari asubuhi. Mimi naitwa Charles Ngude Mpasua. Mimi ni ofisa wa afya nyanjani na pia na lishe bora hapo Barani. So nashukuru, karibuni.
Habari zenu? Nzuri. Mimi ni kazi hapa na sasa upande wa pharmacy na upande wa
Kilifi South County, Chameleon, CHP, North Coast, and the German doctors and my fellow healthcare workers and the general public. Good morning. So it is my pleasure to be here today. I didn't know Barani, but now I'm here. So last year around August, there was this establishment of the primary healthcare network for Kilifi South. It was a very good start, but later on we found ourselves not really doing some activities. But here comes the time whereby on behalf or together with collaborating with the German doctors, CHPF, we are really doing something great. And I really want to thank the German doctors for coming up with this innovative way of providing healthcare services to the community through the rolling clinic. So one of the primary role of this primary care network is to try to, bring efficiency in our operations when it comes to patients referral as well as accessing health services to the community. So I take this opportunity to thank everyone and as a team, and I'm sure with the able lead with Mumbo, Sultan and all the partners, I'm sure we'll ensure that primary care services are being provided at the lowest level of healthcare in our community.
Part of this opening, I'm very happy to be here. Also, I bring many regards from my boss, from Dr. Christine. She's like a board member in German doctors in Germany. So yeah, very many greetings. She will also come to visit the project very soon, so she can also see what's going on the ground. Yeah, and I'm also very happy to learn about the changes of the project that's going on now with the rolling clinics coming out in the different areas. So also, I think that was also a long planning process in advance, so I'm really happy to see that's now opening officially, it's really working, it's going on. And me as an M&E position, I'm always very interested, of course, in learning what's really changing because of having the rolling clinic here. So I'm really happy to learn in the next weeks, months and maybe years to learn what's really changing for the community we serve, for the people in need, for the vulnerable people. So yeah, I'm happy to be part of the process and support here and there. And thank you so much for inviting me today.
Mr. Mumbo, Dr. Sultan, Dr. Ya, Annika, all staff from Barani was here, the German doctors who are visiting, the staff from Barani Clinic specifically, our students from North Coast and all other visitors, everybody who I've missed. Good morning. And I think I'm so glad to be here today. I think this is the second occasion where I can really say from where I stand as a Board of Trustee member for Community Health Promotion Fund and as the Director of North Coast Medical Training College that we are really achieving what we want to achieve in collaboration in supporting primary health care. The first one was when we opened the Barani collaboration, where we have been working together since 2021. With the county, with the clinic, with North Coast, with German doctors also that time, and then now today. So we want them to feel that when they come to Barani, they get services that address most of their needs. And only if it cannot be done here, they do it. And I think that's what we've all worked towards. And I think when we started collaborating, we didn't know each other very well. We were the private sector, so to say. The county was the county. We had all this getting acquainted to one another to cross. But I believe over the years, we have started to trust one another. We have started to get more and more. And we know we all try for where we stand. I remember when we first tried to go into an MOU with the county, which questions do I get? What is your budget? Do we have bills of quantity? And we told them we don't have budget, we don't have bills of quantity. What we say is that if we collaborate, we will try to do our best to make things better.
I had a meeting very early in the morning with the minister, and we discussed about my coming here today. And what we were saying is we are walking the talk, because it is the governor's manifesto that we strive as much as possible to take the services to the community level in the theme Afya Mashinani. I want to appreciate the effort and the contribution of the German doctors, because they are doing it in a very special way. That over the recent past, because they are not very old in the protocol of running the rolling clinics, but in the recent past, a lot of good work has happened in this county, especially in Kilifi South. And in the idea of taking services closer to the community, I think the rolling clinics have come at a time that we are speaking primary health care, because prevention will remain to be better than cure. And the access to quality health services in this county remains a very big challenge, because of either the distances that the community members have to cover to just go and see that consultant. Okay, karibuni sana kwa huduma. I want to talk to the community briefly. So I carry my gadgets. Yeah, because like Dr. Marianne said, we're in a new dispensation. We are moving from NHIF to SHA. So I want to talk to the community briefly, and also thereafter I will have a separate talk with the support staff for the facility and the health promoters for the facility. I have one or two to talk to them. But first of all, let me say hi to the community members and the beneficiaries of the service. Thank you so very much, Dr. Maria.
Sisi tunashukuru kwa sababu ya German doctors. Katika ule muda tumekuwa hapa Barani dispensary, hizo enzi za nyuma ilikuwa tunapata shida kwa sababu tulikuwa daktari wetu ni kidogo, services zilikuwa zinaenda delay, lakini German doctors walipoanza hii kutiamua wanakuja kila Friday, tunaona manufaa. Sasa hii tunaona watu wengi wanakuja, wengi wanapata service. Tunaona watu wa pressure penye msaiwa wanaendelea wanaleta dawa za pressure. Watu walikuwa wakipata shida sana kwa sababu wengi walikuwa wanaenda mbali kutafuta, wengine walikuwa kwa manyumbani. Mimi kama CHP wengi tulikuwa tukiwatembelea, unapata mtu unamrifaa pressure huko, hatuna hata vipimo, hatuna madawa, lakini tunashukuru German doctors kwa kutuletea huko kila wakati wanatusupport na watu wa pressure, sukari, mambo mengi wamekuwa wakitusupport. Sasa hii tunashukuru sana kwa sababu German doctors walikuwa wakitusaidia.
Huko wanaenda kule vitongojini tena kwa mpango. ili tuweze kupunguza gharama ya mwananchi kutembea na kutafuta huduma bora za afya. Sasa nyinyi watu wa Barani mna bahati, kwa sababu huyu daktari yako na jopo lake ikiongozwa na madaktari bingwa wako hapa leo. Kuna daktari mama, daktari bingwa wa masuala ya mambo ya wakina mama leo yuko hapa. Kuna daktari bingwa wa masuala ya yale magonjwa kama ya sukari, presha, kansa leo yuko hapa. Kuna daktari bingwa wa masuala ambayo yanahusu watoto leo yuko hapa. Kuna daktari ambaye pia ni bingwa kwa mambo ya lishe leo yuko hapa. Kuna daktari bingwa wa mambo ya mazoezi leo yuko hapa. Sasa nyinyi leo, na si leo peke yake tu, leo na siku zingine za usoni mtakuwa mkiendelewa kupata hizo baraka hizo za kwamba nyinyi msiende Mtwapa au Kilifi. Ni siku itawekwa, siku yako ikifika anakuja tu hapa, unatoka pale nyumbani, hata kama ni pikipiki unalipa 50, unakuja, wagonjwa ni wachache, unaonekana, unarudi nyumbani kwa ajili ya shughuli zako. Na huduma hizo kuna zingine kulingana na uhitaji. Kila wiki watakuwa wakija hapa kusaidia hao madaktari huyu na ule mwingine na hao wengine. Watakuwa wakija kila wiki. Si wote, lakini baadhi yao watakuja kila wiki kulingana na uhitaji wetu watu wa Barani, kuhudumiwa vizuri na kurudi nyumbani tena vizuri.